Okay, and now we're going to talk about managing COVID-19 in the workplace. So hopefully you've implemented the basic safety tips we talked about, you've implemented the industry-specific guidelines, but there is still a possibility that someone on your staff or a customer or someone might bring COVID-19 into your workplace. And before we get into what you should do in these situations, I just want to emphasize that we need to be careful to not create stigma. As you have probably heard from the news, around the world, COVID-19 is spiking right now. And as we mentioned at the beginning of this presentation, it's spiking here in San Diego. And so it's definitely likely that an employee might have COVID-19 at some point. And we want to make sure that we create a culture where people know what they should do in that situation and feel safe and comfortable in coming to you and letting you know if they were exposed or if they are sick, so that we can adequately respond to it and prevent an outbreak in our workplace. So first step is vigilance. You are required to screen your employees for symptoms or exposures at the start of every shift. And so if they answer yes to any of these symptoms, or if they have been exposed to someone with COVID-19, they need to immediately call their healthcare provider or 211 to get further directions on whether it's safe for them to continue to work, or if they need to quarantine or take additional measures such as testing. So if you do have a case of COVID-19 in the workplace, this is a flowchart from the county on how you should respond. Hopefully you've seen this before. If not, it is linked in this presentation, and it's also available in Spanish. So this is for you as the employer. The employee who tested positive should stay home for 10 days, and they can't come back to work until those 10 days are up and they've had an improvement in their symptoms. Second, you want to deep clean the area. Third is really important. You are required to notify the county public health services if there is a case of COVID-19 among your employees. So you want to make sure that you have the employee's name, date of birth, and contact information available. It is a hotline where you leave a voicemail, so you won't directly get to speak to someone when you call this number, but this lets the public health services know that you have a case of COVID-19 and that you need assistance. And so they will, they will contact you so that to work with you on contact tracing and stuff in the workplace. Another important step is if you are required to report illness or injury to Cal OSHA, there are certain occupational health reporting requirements related to COVID-19. So I highly suggest that you click on this link and read more about those. And finally, you will be required to provide notice of exposure if employees within your workplace, again, came within 6 feet for 15 minutes of someone who was diagnosed with COVID-19, you need to let them know. And this link here, the COVID-19 Employer Playbook for a Safe Reopening, has really good information on how you can go about that. They have a sample notification email of what you're allowed to say. It's really important that you are always confidential about the employee's information. So if an employee has COVID-19, you cannot tell other employees, oh, so-and-so had COVID-19. You can't give them any information about their health status because this is sensitive information. So make sure that you are aware of those guidelines. And again, you can find them by checking out the Employer Playbook. So I'm going to be presenting some common scenarios that Dr. Sarah Baird helped me put together of what a case of COVID-19 in the workplace might look like, and some examples of how you should respond. So before we get into this, I just want to highlight a few key things. First and foremost, always, always, always contact the healthcare, you want the employee to always contact their healthcare provider or 211 if they have any symptoms or if they've been exposed. Getting the advice of a medical professional on what to do next is the very first step in every case. And then sometimes the healthcare professional will recommend quarantine or isolation. And if that is the case, the employee must stay home for that entire quarantine or isolation period. Dr. Baird likes to say, you cannot test your way out of quarantine. Even if the employee tests negative for COVID-19, they have to finish their quarantine period. And this is because the coronavirus test is not 100% accurate. There are many different factors that play into why someone might test negative, even if they really have COVID-19. And so a negative test doesn't mean that you don't have COVID-19. That's why this is really important. Again, our close contacts definition, and then finally, make sure that you know about employee confidentiality and privacy, because you want to be careful about what information you share if an employee has COVID-19 in your workplace. Okay, so our first scenario, what should you do if an employee calls out sick? First thing is that they should not come to work. And second is that they need to call their healthcare provider or 211 to see if they need testing and to see if they need quarantine. The healthcare provider may decide that they don't have any COVID-like symptoms and they might be allowed to come back to work, but you want that to be up to the healthcare provider. So that's why it doesn't matter why they're calling out sick, have them talk to their healthcare provider. If the healthcare provider decides that they do have symptoms of COVID-19, they will have to isolate at home for 10 days. They can't come back to work until it's been those full 10 days and their symptoms have been improving. You might have a period where you're waiting for a test to come back. In that case, you definitely still want to be considering sanitizing all your work areas, notifying close contacts, doing everything you would if it was a case of confirmed COVID-19. And this type of leave does qualify for paid sick leave. Again, if the test comes back negative, they still have to quarantine for those entire 10 days. And if it comes back positive, you want to be following the county flow sheet on the proper reporting guidelines. So an example of this, this is a real example of a situation that happened in a workplace. An employee called out sick because she wasn't feeling good. And she stayed home for like 3 days until she felt better, and she never contacted her healthcare provider. So she came back to work for like an additional 4 or 5 days before she realized she still wasn't feeling that great, and she finally got tested for COVID-19. And it turned out that she tested positive. So those entire 5 days that she decided that she was feeling fine and could come back to work, she could have potentially exposed her fellow coworkers. So this is why it's really important, if they call out sick for any reason, make sure that they're getting evaluated by a healthcare provider in case it's related to COVID-19. Just a reminder of the COVID-19 symptoms. This is from the CDC. It's the typical ones that we think of, like cough, shortness of breath, fever, but also you want to be looking out for vomiting or diarrhea and loss of taste or smell. These are less common symptoms, but they still can be symptoms of COVID-19. So make sure that you're screening thoroughly. Our second scenario is an employee with a COVID-19 exposure. So again, this is the employee doesn't directly have symptoms or feel sick, but they came in contact with someone who was confirmed to have COVID-19. If they report an exposure, which you should be screening for at the beginning of every shift, they should go home immediately and call their healthcare provider. If the healthcare provider determines that they have had a COVID-19 exposure, they are going to have to quarantine for 14 days from the last close contact. And again, even if they test negative, they have to quarantine for the full 14 days. In this case, you don't necessarily have to report to the county because it was an exposure, but you should highly consider treating it as a potential case of COVID-19 in the sense of sanitizing the work areas, notifying close contacts of that employee, making sure that they're extra vigilant if they have any symptoms at all, that they should be watching out, especially for the possibility that they might have been exposed. And then Again, this type of leave does qualify for paid sick leave. If the employee ends up testing positive, then you do want to follow the flow sheet for reporting. An example of this was in a workplace, one employee reported that someone in his household was sick and was being evaluated for COVID-19, but it wasn't confirmed yet. In this case, the employer did the right thing, told them to stay home and get tested. Eventually, the employee did test positive, but because he had been working from home, they were able to prevent any possible exposures of his coworkers in the workplace. So that's why even if an employee was exposed to COVID-19, you want to make sure that you're following these steps. And finally, of course, if an employee tests positive, they shouldn't be coming to work. They should have probably already been instructed on staying home, but if they haven't received instructions for self-isolation, they should call their healthcare provider or 211 to get that information. And then you as an employer, should be following all the steps of the flow sheet to identify close contacts, letting them know that they've been exposed to COVID-19, reporting to the county, and reporting to Cal OSHA if that is required for your business. So just a recap of this portion of the presentation, how to implement safety in your business. The first and most important thing is communicating with your employees. You want to make sure that they know about your safety policies, the preventive measures that you're putting in place. And you want to make sure that they know what's going to happen if they do have symptoms of COVID-19. You want to have a protocol for that and make sure that everyone is informed and aware so that you can take action immediately. Again, social distancing, face mask sanitation, we're all tired of it, but it's essential that it keeps going, especially since COVID is becoming more prevalent in our community right now. Again, refer to industry-specific guidelines for your safety measures in your business, and follow the county flow chart if an employee is symptomatic. And then finally, it's never a bad idea if you have any doubts or questions, calling the Department of Health, calling 211 for more information and guidance. They will be able to connect you with any resources that you need related to safety.